Sexual intercourse is one of the reasons why women may get urinary tract infections.
Hello, I'm Dr. Poongkodi. I'm a consultant urologist working in Pantai Hospital Kuala Lumpur. Many people think that urology is about prostate, penis, and testes, but there are many women and children with urological conditions who often don't know where to seek help. I'm here to answer some private or embarrassing questions that you may have, but are too shy to ask your doctor.
Is it normal for women to pee when they sneeze? Women pee when they sneeze. This is called stress urinary incontinence. Women may also pee when they laugh or when they exercise. Stress urinary incontinence is a common condition. It affects older women, women who have had many children, women who may have had menopause and gained some weight, and there is treatment for it. Most of the time, the management is losing weight, doing some pelvic floor strengthening exercise. But then, if it doesn't work, then there are surgical options. There are some women who may have a different type of urinary incontinence called urgency incontinence. This is when women feel like they need to pee. They may be peeing frequently, more than 8 times a day. They may be waking up at night to pee. And you may find that they just reach the toilet and they leak urine. So this form of urgency incontinence can be managed with lifestyle measures such as having a schedule for drinking and peeing, training your bladder to hold urine for a little bit longer when you have that urgent need to pee, and also medications such as anticholinergic medications, which are commonly used. Urinary incontinence is not normal. Many women think that this is part of growing older and that they have to live with this kind of symptoms. Urinary incontinence can be treated. It doesn't always involve medication, surgery, and sometimes you just need a consultation and some good advice. Does pregnancy cause women to pee more frequently? Yes, pregnancy does cause a woman to pee more frequently. Some of the reasons for this is that when a woman is pregnant, there is increase in blood flow, generally to the entire body as well as to the kidneys. Another reason why women pee more frequently when they're pregnant is that the growing uterus will tend to fall on the bladder. And this means that the bladder may not be able to hold as much urine as it used to. No worries, if a woman is pregnant and she's peeing more frequently, that is pretty normal. However, if you have burning pain when you pee, or you find that urinary stream is not as normal as it used to be, this could mean that you have a urinary tract infection or a bladder infection. Now, bladder infections in young women who are pregnant needs to be treated because untreated bladder infection can cause an infection of the kidneys called pyelonephritis, and this in turn can lead to premature labor. Is it normal to get recurrent UTIs? It is common for women to get urinary tract infections because their urethra or the urinary passage that drains the bladder is shorter than men. Having more than 3 urinary tract infections per year is not normal. What are the reasons women may get recurrent urinary tract infections? It depends on their age and their lifestyle. The commonest reason for a woman to get urinary tract infections is that she may not be emptying her bladder completely. As women grow older and become menopausal, they would find that they have a condition called atrophic vaginitis, where their vagina becomes dry and they lose the protective effect of a bacteria called lactobacillus. This in turn leads to more frequent urinary tract infections after menopause. Is back pain a symptom of kidney stones? Now, there are many reasons for a person to have back pain. Urinary tract stones form in the kidney. And when they are in the kidney, they hardly cause any pain. The pain occurs when the urinary stone travels down the ureter, which is a tube attaching the kidney to the bladder. How do you know you may have a kidney stone that is traveling down the ureter? The primary symptom would be severe upper or lower back pain, pinkish urine or blood in the urine, vomiting. Sometimes you may have fever. Should women pee after sex? Yes, I believe my colleague Dr. Satya, who is a resident consultant urologist in Pantai, also mentioned this in a separate video before. Sexual intercourse is one of the reasons why women may get urinary tract infections. In fact, there is a condition called honeymoon cystitis, where a patient or a woman is with a new partner or has recently got married, she may find that she has more frequent urinary tract infections. This can be prevented by peeing immediately after sexual intercourse, washing with water and not using any of the feminine products that may alter the pH of the vagina. On the other hand, urethral discharge, severe pain during urination may also indicate a sexually transmitted infection. This needs to be treated and diagnosed by a doctor.
Thank you so much for your questions. I hope that I've been able to be of help. And if you have any further questions, feel free to leave them in the comment section below.